All right, so before I do the procedure, I'm going to check my medical order, make sure I have an order to suction the tracheostomy, as well as perform a sterile trach care. The supplies I'm going to need are a trach care kit, a Chuck's pad, sterile saline, and a pulse ox. So I'm going to come in the room, perform my sandwich. So knock on the door, perform hand hygiene. This procedure also takes a partner, so I'm going to have a partner come in during the procedure. My partner's name is Catherine today, so we're going to go ahead and get started. So I'm going to come in the room, introduce myself. Hi, my name is Faith. I'm a nursing student from Northwest Arkansas Community College. I'm here to perform tracheostomy care. Can you tell me your name and date of birth? Are you allergic to anything? We're going to be doing trach care. I'm going to help you cough and deep breathe. I also want to make sure that I have my trach mask, that it's set to the appropriate oxygen rate. I have my ambu bag hooked to oxygen. I have to have suction and suction tubing. So I'm going to get ready to check that in just a minute. I'm going to make sure that my suction is on continuous and that it's set to 100 to 120. And the way that I check that is by either putting a cover on the end or crimping my tubing, so it is at 100 to 120. And then my oxygen I turn all the way up because I'm going to be hyperoxygenating the patient. I'm going to go ahead and raise the bed up. To a comfortable working height. I'm going to lower the rail on my side. I'm going to grab a Chuck's pad and put that over my client to prevent any mess. I'm going to put a pulse ox on the side of my partner so they can help me monitor my client's oxygen level and heart rate throughout this procedure. I have a trash can that I try and keep near my feet so I don't make a big mess everywhere. I've also got my overbed table and my saline. And it's time for me to open my trach kit. I'm going to open my sterile gloves. All right, so I got the first pair on. Step back. And get that out of the way. I'm going to grab the drape, shiny side down, drop it on my tray table. I'm going to grab my suction catheter, my brush, my 2 cotton swabs, my fenestrated drape, my 2x2s, and my trach ties. And then I'm going to have my partner come and pour my saline into my sterile tray table. She's being careful not to cross over the sterile field. Okay. Then I'm going to grab my suction tube and connect this. This is now this hand is now not sterile anymore. This is still my sterile hand. I'm going to moisten the tip. As I'm doing that, I'm having my partner pull the mask down and ventilate 3 times. This helps pre-oxygenate the patient, stabilizing the faceplate. Then I'm going to go into the trach no more than 10 to 11 centimeters or 4 to 5 inches. So I'm going to go right in the middle. I am not holding suction down. or my patient coughs. Then as I go to pull back, I'm going to intermittent suction and kind of swirl it around. I'm going to have my partner do 3 more. And I'm checking the pulse ox as we're doing this.
98%.
Perfect. I'm going to have my patient take some nice big deep breaths and cough. I can do this up to 3 times, 30 seconds to 1 minute apart. I'm going to have my partner replace the trach mask. This patient does not need any additional suctioning, so I'm going to suction in their mouth now, just to kind of clean up any mess. Once it goes in their mouth, it does not go back in the trach. Then I'm going to disconnect, keeping this hand sterile, and drop that in my trash can. My partner's turned off my suction for me, and then we're continuing to monitor the client's oxygen level. We're going to remove the trach mask down. I'm going to grab with my non-dominant hand while my partner holds the faceplate, and then I'm going to drop this in my first tray. I'm going to grab my brush to clean my inner cannula. Pull it out. I'm going to be sure not to touch my gloves or any part of the inner cannula. If I do that, I would need to repeat this procedure. Then I'm going to put this in my second tray. Then I'm going to grab this with my sterile hand, tap, tap, tap. Then my partner stabilized the faceplate, and I just reinsert my inner cannula. Once I get done with that, if I have a partner with me, I'm going to undo the trach ties and have my partner stabilize the faceplate for me. Then I'm going to grab my old dressing, assess for any drainage, anything like that. This procedure requires 4 Q-tips because we're going to clean 4 different sections. So I'm going to go in my remaining. I'm going to assess the stoma for any redness, drainage as I'm cleaning. So I'm going to start here in the middle and go out, throw out, new, middle, out, new, middle, out, new, middle, out. Then if there's any kind of moisture, I'm going to take one of my 4x4s and kind of pat dry and make sure that I'm not causing any further breakdown from just having too much moisture. I'm going to grab my fenestrated drape and put that around my client's tracheostomy. Then I'm going to assess the back of my client's neck. So I'm going to have my client sit up with my partner stabilizing. I'm going to look for any signs of breakdown, any drainage, and if I needed to, I would clean the back of their neck with one of my 4x4s. Then I can have my client lay back. I'm going to grab my trach ties, feed it through my faceplate. Making sure that there's no twist that can cause skin breakdown later. Go around my client's neck. Hand one part to my partner and feed one of the ties through the faceplate. And then just kind of tie it in a bow. I'm going to replace the trach mask, clean up my supplies from the procedure, Assess the pulse ox one more time, make sure the patient tolerated well. I'm going to raise the rail, lower the bed, make sure my client has their call light, remove my gloves, perform hand hygiene. Then I would document that I performed a sterile trach care. I suctioned the client 3 times, or however many. I got scant, small, moderate, large, or copious amount of drainage, what the color, clarity, and consistency was, what their oxygen level was throughout the procedure, what their heart rate was throughout the procedure, and then what instructions I gave the client. I would also ensure before I left that they had tissues in case they coughed anything up out of their tracheostomy and the trash can was nearby. And that's trach care.